Hey everyone! Today we're opening up a little box that can make a big difference. Your first aid kit. A first aid kit might look small, but it holds the power to save lives. Inside, you'll find bandages, gauze, antiseptic wipes, burn cream, gloves, a thermometer, and even a CPR face shield, each tool designed to help in an emergency. But it's not just about what's in the kit. It's about knowing how to use it. Whether it's stopping bleeding, treating burns, or performing CPR, first aid gives you the skills to act fast and help someone in danger. Because in a crisis, every second counts. And with the right tools and knowledge, you can be the one who makes a difference. Let's get started. Bleeding is the loss of blood from the circulatory system. This can occur internally within the body or externally, where blood escapes the body through a break in the skin. To control severe bleeding, follow these steps. 1. Apply firm, direct pressure to the wound using a clean cloth or sterile bandage. 2. If the bleeding doesn't stop, use a tourniquet above the injury, only if you're trained or instructed to do so. 3. Elevate the injured area if it doesn't cause further harm.
Bleeding.
Bleeding.
Bandage is a strip of material used to cover a wound or support an injured body part. You can see the picture beside it.
Bandage.
Bandage.
CPR, cardiopulmonary resuscitation, is a life-saving technique for restarting breathing and heartbeat. CPR combines chest compressions and rescue breaths to manually circulate blood and oxygen when someone's breathing or heartbeat has stopped.
CPR.
CPR.
Choking is when someone's airway is blocked and they can't breathe. This can be a medical emergency requiring immediate action to clear the obstruction and restore breathing. If someone is choking on an object, first give 5 back blows. Then give 5 abdominal thrusts. Repeat these steps until the object is dislodged.
Choking.
Choking.
A fracture is a medical term for a broken bone. It can be a complete or partial break in the bone's continuity. Fractures are often caused by injury, falls, or direct impact, but can also result from overuse or conditions that weaken the bone. First aid for a broken arm. First, call emergency services. Second, do not move the injured area. Third, apply a simple splint to support the arm. Fourth, prepare an ice pack. Fifth, gently apply the ice pack to reduce swelling. Sixth, seek medical care as soon as possible.
Fracture.
Fracture.
Damage to skin caused by heat, electricity, or chemicals is known as a burn. These injuries can range from minor to severe, depending on the source and extent of the damage. There are 4 types of burns. Depending on the type, Follow these first aid steps. 1. Hold the injured area under cool running water, not cold, for at least 10 minutes. 2. Cover the burn gently with a clean, non-stick bandage. 3. Apply a cold compress to help reduce pain and swelling. 4. Consult a doctor, especially for serious or large burns.
Burn.
Burn.
Tourniquet is a tight band used to stop severe bleeding by compressing blood vessels. It is a crucial first aid tool for life-threatening bleeding when direct pressure is not sufficient.
Tourniquet.
Tourniquet.
If someone isn't breathing properly or has stopped breathing, rescue breathing, also known as mouth-to-mouth resuscitation, can help. This involves providing breaths to the individual until they can breathe on their own or until emergency help arrives. Rescue breathing steps are: open the airway, tilt the head back, and lift the chin. 2. Give a rescue breath. Breathe into the person's mouth for about 1 second. 3. Check for chest rise. Make sure the chest visibly rises with each breath.
Rescue breathing.
Rescue breathing.
Automated external defibrillator, AED, is a portable device that delivers a shock to restart the heart. It's used to treat sudden cardiac arrest by delivering an electrical shock to the heart, helping it to restore a normal rhythm.
AED.
AED.
To quickly recognize a stroke, use the acronym BE-FAST. This stands for balance, loss of balance or coordination, eyes, sudden vision changes, face drooping, arm weakness, speech difficulty, and time to call 911 immediately.
Stroke.
Stroke.
Now I want to talk about essential first aid kit items and their uses. Let's get started. These are adhesive bandages, Band-Aids, and they are used for cover small cuts and scrapes. These are sterile gauze pads, and they are used for absorb blood and protect wounds. This is antiseptic wipe, and it is used for clean wounds to prevent infection. This is antibiotic ointment, and it is used for prevents infection in minor cuts. This is an elastic bandage, ACE wrap, and it is used for support sprains or hold dressings in place. This is a triangular bandage, and it can be used as a sling or to wrap large wounds. This is a tweezers, and it is used for remove splinters or debris. These are scissors, and they are used to cut tape, gauze, or clothing. This is a cold pack, and it is used for reduced swelling and pain from injuries. These are gloves, non-latex, and we can use them to protect both you and the injured person from infection. This is CPR face shield, and it protects during rescue breathing. This is thermometer, and it is used to check for fever or illness. These are pain relievers, and they are used to reduce pain, swelling, or fever. This is the emergency blanket, and it is used to prevent heat loss in shock or cold conditions. This is a flashlight, and it is useful in low-light emergencies. This is a burn cream or gel, and it is used to soothe minor burns. Thanks for watching. Remember, first aid isn't just a skill. It's a way to protect the people you care about. Whether it's a small cut or a serious emergency, knowing what to do can save a life. So keep your first aid kit ready, keep learning, and stay calm in the face of danger. Because heroes aren't always in capes. Sometimes they're the ones with bandages and a steady hand. Stay safe, stay prepared, and I'll see you in the next video. Don't forget to like, subscribe, and ring the notification bell so you won't miss any of our new videos.